Thank you, Mayor. And I want to draw everyone's attention to the graph in front of you because you see that, as the Mayor pointed out, our positivity rate is 6.1%. But I also want you to see that on the far right side of that graph, that those bars are very, very short because it's early data, it's recent data, and if you look at just the previous several weeks, you can see it's a small amount of data compared to what we had accumulated over the previous number of weeks. You will also notice, for those who've been paying close attention, that last week we reported 6.8%, and this week it gets recalculated 7.8%. So that's as more data comes in. And if you remember, we had predicted that that is exactly what would happen, is that as a few weeks of more data come in, because the labs and the state, we've asked that they report the positives first, so we're going to see a bump up in this. And so as the Mayor said, and want to reinforce, if you look at those numbers over the past 4 weeks, they are coming down. And that's the important thing to focus on, is that the numbers are coming down. The numbers are coming down for a reason. It's not random, it's not by chance, it's not good luck. It's because people are doing things that we've asked them to do, and wearing the mask and staying apart from each other. Now, the other thing to keep in mind is that there are shortcuts people can take. So one of them, I'm seeing more and more people wearing visors instead of masks, the clear visors. And I want to point out that if you want to wear a clear visor on top of a mask, that's fine. That'll protect your eyes from becoming infected if somebody should cough or sneeze. But the visor alone does very little help. And there was a study that came out just recently. I don't have any of the graphics that show up, but it basically showed that the visor alone is essentially useless in protecting anyone in the event that you're sick. It's also almost useless in protecting you if someone near you is sick. So if you want to wear a visor, that's fine, but it needs to be worn in conjunction with a mask. So it's the masks that are the important thing. They predominantly protect the people around you in the event that you are unknowingly sick. And remember, a very high percentage, somewhere at least 40% of people who are sick don't know it. But it also provides you some small protection from becoming infected. The visors, however, provide no protection along those lines at all. And so they are only good to protect your eyes from becoming infected if you're also wearing a mask.